Okay, quick update. There I go saying again. Excuse that, my mannerisms. But last night was a great night for Clay. He did finally get the medicine combinations that he needed, and the nausea is pretty much gone. I think the only time he really has an issue is when he moves a lot, and so they want him to not get up a lot just yet because the incision is so extreme. And I saw the incision. I can't think today. For some reason, my mind's in a fog, and so excuse my pauses. But I did see the incision, and it is horrific. I have never, I don't think I have ever seen a cut so big. I counted the staples today, and there are 32 staples. They are, most of them are in line, straight down his stomach. There are 3 smaller incisions that they stapled where they tried to do robotic and couldn't get that accomplished. So he actually has 3, 4 incisions, 1 major incision, and 3 smaller. So he seems to be in pretty good spirits today. I think he's anxious for the results to come back so we will know what stage he's in. There's just no way of knowing just yet. I don't think the doctor wants to speculate. I'm pretty sure they know, but I don't think he wants to give us what he thinks and then it comes back differently. So we probably won't have those stuff on me. Probably, excuse me, probably won't have those results. He said 5 to 7 days after surgery. So we're not going to anticipate getting those anytime soon. The day went pretty well. I was able to get up there fairly early this morning. It's a whole routine down here to get things up and running in the mornings. We've got dogs and we've got 2 cats that we feed and we keep in our shed. So it's a pretty full-time routine here. But anyway, I got that, I got everything squared away here, and I headed out. I got there around 9:30 this morning, I think. He was sitting in his chair. He looks very good. His color is very good for someone that's been through such a traumatic experience. So they did let him start having some, excuse me, I've got some kind of sinus thing going on, and it's draining in my throat. But they did let him have some chicken broth. Chicken broth. They had that. I've got a glare, but they did let him have that, and he didn't want very much of it. He's not really hungry, and we don't know if that's because he's in so much pain, or if it's the effect of the pain medication, or if it's an effect from the chemo. We don't know. I do know something about chemo, but it's been a long time, so it could be a result of that. I kind of doubt because it was flushed right into his bladder. It didn't go through his bloodstream. So I don't think it's that. I think it's just his system is just trying to recover, and it's going to be a long haul. And so he had already taken 1 short walk, just a few steps. After he got in his chair, he decided, so they brought somebody in to help him walk. And pretty much he's just resting. That is very important for him to get plenty of rest. It's very hard for him to lay in that bed. Those things are not comfortable. But he's making do with what he has. The excuse me, the kidney function is very good. The other kidney has kicked right in and is doing awesome. We couldn't ask for better results on that. The only issue I think he had was his sodium was very low, so they've been giving him something to, accommodate that and fix that. But he's still got IV. They want him to have plenty of fluid going through. Today's the first day he's been allowed to have free um, liquids, as far as he can drink as much as he wants, and he can, drink the soups. I am so sorry. Excuse me. He drank a little bit of soup. He drank a little bit of cranberry juice, and he ate part of a popsicle. So that's pretty good for being sedated as long as he was. So it's it's a it's looking promising. We are very optimistic that the rough patch, the real rough patch, is over. I think he felt a lot better once they took the bandage off of his incision, because they had that on there pretty tight. So they did that. He still got the Foley in. We were kind of hoping to lose that. He still has the little, I can't remember what it's called, but the little thing that drains out with his incision. He still has that, and I'm pretty sure they said he would be going home with that for the first week. So we're hoping the Foley might come out tomorrow. I kind of hoped it would today, but definitely we're looking for tomorrow for this to come out. I don't think anything major happened today. The doctor came in and apologized again for making such a huge incision, but it just couldn't be helped, and we understand that. It's just one of those things, and it is what it is. We'll make the best of it. I'm trying to think of anything that significant that happened today, but nothing really. I mean, other than he walked twice, which is huge. He commented about some of the other people on that floor. They're all cancer patients, and pretty much all of them are there with bags and IVs and anything else you can think of to stick in that body. They are walking around with that. So he was pretty upset about what he saw today, and this is his first experience ever with cancer. He had, like I said before, he had Castleman's disease, but he's never had cancer. So this is going to be very eye-opening for him. He's going to see, as bad as it gets, he's going to see all of that. He's going to see, going in and out of these clinics that we'll be going to for the next, I think it's 2 years. There will be a lot of people he's going to see that are much worse off than he is. And so we're grateful. We are very grateful that so far everything looks good. And we're going to take that, we're going to run with it, and we're going to fight. We're not going to be in a false sense of security. We're not going to do that. We are very realist. We are very realistic people. We know what this is, we know the consequences, and we know the majority of the outcomes are not good. It's up to us to make the best of it and fight as hard as we can for as long as we can, and we will do that. So that's about it for today. For those that are concerned, yes, I did get some sleep last night. I tried to take a nap when I got home, but I could not sleep. And I have narcolepsy, so sleeping is usually not an issue with me. But it seems like that stress just works up my brain, and I cannot shut it off. So I think it was around 11 o'clock last night I finally fell asleep. I did take a melatonin, and I slept all night. I don't think I woke up one time until bright and early at 6 o'clock. The dogs were ready to eat, so we've had a full day again today, and I'm going to, take some time and chill. My favorite show is coming on tonight, The Chrisleys. So I'm going to watch that and then probably hit the hay again, hopefully earlier, but we'll see. So thanks for all your prayers, and um, I'll try to make a video tomorrow. Bye.